This is a court entry training for the Eastern Pennsylvania Continuum of Care. This training is on the HUD definition of homelessness, Category 1, and how it relates to a court entry intake assessment and referral. If you have questions, please put them in the chat and we'll address them after the presentation. At the end of this presentation, the recording and the slide deck and any questions that you have will all be posted on the CoC website, probably on a new page, and we'll be able to share that with you, all court entry specialists, as soon as that page is up. So for the first training in this series, we're really focused on the essentials, and we are going to start with Category 1. Just a little introduction if you're newer to the continuum of care and coordinated entry within the continuum of care. It is a large region of Eastern Pennsylvania, 33 counties subdivided into 5 RABs. Our coordinated entry system is accessible to anyone in all 33 counties through various access points that I'll share here. And what is coordinated entry? As a starting point, coordinated entry is the process by which anyone who is unhoused or experiencing homelessness or at imminent risk of homelessness, the way HUD and the federal government define that, can all access services and housing that's available through the network of Eastern Pennsylvania CoC service providers. And as you may know, there are multiple ways to access coordinated entry, either by calling or texting 211 and/or visiting one of over 30 walk-in access sites, usually accessible by appointment only, but sometimes accepting walk-ins, and at special access points through participating domestic violence service providers that are partnering with the CoC to streamline coordinated entry for survivors. It's very important to note that the entire court entry process from start to end is identical for a household, a participant, a family, an individual, regardless of whether they call 211 or visit an access site. So one of the essential things we do is at coordinated entry is to assess people and identify the housing solutions or service solutions that will meet that individual household's needs within the limits of the resources that we have to offer within the CoC region. So these services include street outreach, emergency shelter, rapid rehousing and permanent supportive housing, which are forms of subsidized housing with case management and homelessness prevention services. If these programs are funded by any sort of federal grant from the U.S. Department of Housing and Urban Development, then in order to be enrolled into the programs, people must first be enrolled in coordinated entry and either referred or placed on the by name lists, depending on which type of service is necessary. It's very important. Court entry is not and cannot be a guarantee of any housing or crisis services. So with that overview in mind, specifically the way court entry works within the Eastern PA CoC is, again, whether you're contacting us through our call center with 211 or one of our access sites, through the initial screening process, it'll be identified whether the person calling is eligible for services linked to Category 1 federal and HUD definition of homelessness, Category 4 definition of homelessness, or Category 2, which is definition of imminent risk of homelessness. In future trainings, we will specifically discuss what Category 2 in relation to court entry, as well as Category 4. But for today, we're going to talk about Category 1, which really is a definition of a household that has experienced literal homelessness, and we'll have access to all of the housing and crisis services for unhoused families and individuals. Through the court entry intake process, we'll be assessing people for need based on priority using our housing assessment tool, and placing households on the by name list based on that assessment score. In addition, for Category 1 households, we can make, if needed, referrals to street outreach, emergency shelter, supportive services for veterans' families, which is for veterans only, and community resources, which could be any non-HUD funded resources that are participating with the continuum of care. So there is a very specific definition of Category 1. This is actually written into federal law through the Hearth Act and then enacted by HUD. So if there are questions or concerns about whether a household is meeting the definition of Category 1, and as coordinator entry specialists know, there are other definitions of homelessness, including common and shared definitions in the public, and also another federal definition in educational law, which really defines homelessness in different ways. So there is some tension or conflict between this definition and access to services, because it's a HUD-funded continuum, must use this HUD definition of homelessness. So Category 1 refers to an individual or family who lacks a fixed, regular, and adequate nighttime residence. And that means a combination of three things. One, has a primary nighttime residence that is a public or private place not meant for human habitation, or is living in a publicly or privately operated shelter designed to provide temporary living arrangements, technically including congregate shelters, transitional housing, and hotels and motels paid for by either charitable or government programs. Or the third option is exiting an institution where they have resided for 90 days or less and resided in either emergency shelter or a place not meant for human habitation immediately before entering that institution. This definition, so this is a pretty complex definition. It is not well understood by other systems of care. So there are oftentimes when core entry is contacted by someone exiting or being discharged from an institutional setting, does not have a housing plan through that institution, even though they most likely should, and unfortunately will only qualify for the housing services if they meet that third criterion of Category 1, if not the first two. So that's the official definition we work with. I'm going to unpack now how core entry specialists can navigate people in crisis contacting Connect to Home to understand and identify whether they would meet that Category 1 definition. So this is not something that core entry specialists in the Eastern Pennsylvania CoC need to be concerned with, these record-keeping requirements. But keep in mind that when core entry makes referrals or by name list placements for households, part of the enrollment process for the programs that we are connecting people to do have these record-keeping requirements. So we allow for, as many core entry systems do, self-identification, self-reporting of living situation and homelessness, but at some point in the process, people will have to have documentation of that experience. And so there are multiple ways that documentation can be made, and through a combination of what the participant can provide, what is observed by workers or case managers, outreach workers, service providers. And so it's really important to understand that at some point in the process of accessing housing and services, more documentation and verification of homelessness will be required after coordinated entry. Specifically for core entry specialists, some of the key policies and procedures that are specific to the Eastern Pennsylvania Continuum of Care, I'm just going to highlight 4 of them in this presentation. The first is that families and individuals enrolled in a transitional housing program are not eligible for the placement on the by name list for rapid rehousing or permanent supportive housing. This is a local continuum of care governing board decision that, because there is so much demand for emergency services and housing programs, that transitional housing projects are really intended to help people be prepared to exit from that program into a permanent housing situation with stability. And so the CoC has decided to limit access to people who are primarily unsheltered, living in a place not meant for human habitation, residing in an emergency shelter, or meeting that institutional definition. What this means for core entry specialists is do not enroll people that are currently enrolled in a transitional housing program into our Category 1 core entry project. Second point to bring forward, there's a question, there's a part of the definition of literal homelessness, Category 1, that says if someone is living in a hotel or a motel and their stay is paid for by a government or a nonprofit entity or charitable organization, that they are not eligible for Category 1. This specifically, to break that down into a more precise detail, unless 51%, more than half of the hotel motel fee is being paid for by charitable organizations or federal, state, or local government programs, then that household is considered self-paying. So if the household is paying for most of the hotel motel stay, and subsidized less than 50% by a public or charitable source, then they are not eligible for enrollment into our core entry Category 1 project either. Third major point, to be eligible for our Category 1 core entry program enrollment, the household must have been literally homeless the night before contacting core entry. This is part of, again, the federal definition and HUD policy and practice. That's a really challenging moment for people in crisis as well as core entry specialists. If they are sure they're going to be homeless this evening, but they were not last evening, the question around current living situation is always around where they were the previous evening in terms of their living situation. So if they were not literally homeless the evening before enrollment in core entry, then they are not eligible for Cat 1. If the household stayed with friends, family in their own housing unit, or a self-paid hotel motel stay, they cannot be enrolled into our core entry Cat 1 program. There is one minor but important exception to this rule, which is that if an unsheltered household is enrolled in a shelter and is experiencing little homelessness but has not had a core entry intake yet, they can shelter for up to 2 business days before they'd be required to have a core entry enrollment. So it's possible that core entry specialists may encounter a client record where the client has already enrolled in a shelter program without a core entry enrollment and is now contacting us for a core entry enrollment. That's the only situation in which it's permissible for someone to be enrolled in a continuum project before they have their core entry enrollment. A couple of the other key sections of the definition of Category 1 are the reference to institutions. So the third of 3 ways to qualify as Category 1 is exiting an institution where the person has resided or household has resided less than 90 days and was experiencing literal homelessness immediately before entering. Primary institutions are jails and prisons, hospitals in multiple kinds, whether it's primary care, specialty care, behavioral health hospitals, and inpatient treatment centers. So outpatient treatment is not an example of an institution that would qualify someone for Category 1. A person can be considered homeless if the stay is 90 days or less and have met the definition of homelessness prior to entering the institution. One of the most challenging aspects of determining whether a household is Category 1 is what is meant by place not meant for human habitation. There is not one definitive list that one can point to on a website, for example, or a document of exactly what the federal government means by not meant, but there is a lot of practical guidance. And so examples of places not meant for human habitation range from streets, sidewalks, cars, parks, campgrounds, to airports, bus stations, train stations, abandoned buildings, college or school common areas, a garage, shed, or other location outside of a housing structure. If someone is living in a shed on someone else's property, that is technically outside of the housing structure, meaning the internal living space, and that would be considered a place not meant for human habitation. Living in or sleeping in hallways of an apartment building or a hotel, not be when someone does not have a paid rental or unit in that apartment or hotel or rented a room, that is considered not meant for human habitation. And residing in any property that's been condemned is absolutely considered a place not meant for human habitation. There is still some interpretation necessary in how people are describing their living situation and whether they meet that definition. And I think it's widely acknowledged that this is not an exact science. And again, part of the process of engaging and enrolling a household in one of the continuum projects after core entry is to document that homelessness status or verification. So what part of what we mean by what is considered uninhabitable is what are the minimum standards for an existing structure and whether or not it is meant for human habitation. That really depends on three key factors for the most part. First, a house, apartment, single room occupancy, or mobile home may be considered a place not meant for human habitation if it's condemned, or it does not have access to utilities like electricity, water, or heat because the utility lines are broken or damaged beyond repair. That is different from the utilities lines not working because the utilities are shut off due to unpaid bills or arrears. In that case, the housing situation is still considered meant for human habitation, and the household living in it would not be considered literally homeless in the Category 1 definition, but they may be a candidate to refer to a local utility assistance program or a statewide utility assistance program. And probably the hardest interpretation is this section. A place meant for human habitation must be free of dangerous health and safety hazards, which could include electrical hazards, extreme temperature, fire hazards, lead-based paint, mold. If a property is just overwhelmingly covered in mold and has not been, and the person living there or the household living there cannot remediate that, then that could be considered a place not meant for human habitation. So there are always going to be situations that don't fit neatly into either the definition itself or these explanatory notes. A core entry specialist can always reach out to one of our 5 regional core entry managers or the core entry consultant, or if they have any questions about whether a particular specific household is eligible for Category 1 and is in a situation that would meet one of those 3 Category 1 conditions. Of course, probably starting with asking your supervisor, but the regional managers and I, as the consultant, are always available to answer those questions for core entry specialists. That is Category 1 in a nutshell. These are some resources that could be valuable for core entry specialists and others to understand core entry. The first 4 are accessible through either the CoC website or the dedicated Google Sheet that contains the referral partner matrix that is updated live daily and as needed and is used by a core entry specialist to make referrals. And then the last resource is a HUD policy brief defining in more detail what coordinated entry is. If you need more information, please visit the CoC website or contact core entry regional manager or myself as the consultant. And that is our training on Category 1 definition of homelessness. Again, the slide deck, the recording, and any questions that either follow from further discussion in open office hours or follow-up will be asked, answered, and posted as well on the CoC website. So look for more information on how to access that in your email.